Welcome to the Doctors Hospital Distinguished Lecture Series. Every month we invite members of our medical community to speak on topics that matter to you, the Bahamian public. We trust that you will find this information useful. Now sit back, listen, and learn. Isn't your health worth it?
Good evening. I'm so happy to be here to share some information with you. So I'm going to try to present a very simple, short, concise subject, and hopefully in the question and answer, if you have any questions and stuff, I basically like to answer. Okay. So what we're going to talk about tonight basically is peanut allergy, but specifically if it can be prevented. Well, as Ms. Turnquist said, I'm an allergist. I'm also a pediatrician. To become an allergist, you basically had to be an adult doctor or internist, or you looked after babies, a pediatrician. And after you basically finish your training, if you decided to subspecialize in allergy, you basically enter the program. Most allergists are either pediatricians or internists who look after adults. But in the program, we see all ages. And basically, when you finish your training, you have an option. You can do like what I did, even though I'm a pediatrician. Most of my patients here in Nassau who see me for allergy are adults, so you can see all ages. Some people may feel it more comfortable just dealing with the little ones, the pediatric allergy patients, or the big ones. But I see everybody, okay? Okay, so the talk tonight is about how we may prevent peanut allergies. It's going to be a very simple talk, no big fancy medical terms, okay? I promise you that. I think it's incumbent if, when you're talking to an audience, you try to educate them a little bit. So we'll have 2 or 3 little medical terms, and at the end of it, you're going to get a quiz, and the only way you can leave this room if you pass all questions. Don't worry, I'm just joking. Okay, so I have no conflicts of interest. I don't work for anybody except my beautiful family that's on the back and our ferocious guard dog, Nutmeg. So you can say hi to Nutmeg. So as I said, very simple talk, but to best understand it, there are certain concepts I think I just need to throw out at you. And that's about what's immunology, and the difference between an allergy or what we call sensitivity. That's very, very important. So I know at the end of this talk, when you go speak to your doctors or your friends, you'll be in a much better position to, intellectually, a more educated conversation with the doctors. So we live in a world where there are gazillions of microorganisms. Viruses, bacteria, fungi, and they only have one intent. They want to turn us into pulp so they can basically feed on our bodies to appropriate their DNA. They want to kill us. And the reason why I'm here talking in front of you, and you here listen to me, is that in our body we have this system called the immune system that basically protects us. So simply put, on the slide, there are some of the things that the immune system does. Main thing, it basically protects us against all these different microorganisms, or as a famous or infamous president of the United States will say, some bad hombres. Okay. The second thing is that the cells in our bodies are constantly dividing, and sometimes when they divide, sometimes the DNA machinery goes awry, and cancer cells develop. This is always occurring in our bodies. And the system that basically detects the cancer cells when they're formed and gets rid of them is the immune system. Okay, so that's what I mean. So that's another function of the immune system. And lastly, our cells don't live forever. So when the cells get tired, and we use the word effete, they are targeted for destruction. There's a big difference when cells die due to injury, or when they are targeted by the immune system for destruction. Now, when a cell dies due to injury or a virus or crushing injury, it heals, but it heals with scar tissue. When the cells has done its usual work and the body says, it's time for you to go, the term we use is called apoptosis, targeted cell death, and the cell just vanishes and the body just basically utilizes all the instruments. So that's what the immune system does. Very, very important system. If it wasn't for it, I couldn't be talking to you. Now, sometimes, the immune system doesn't do what it should do, okay? And an allergy basically is a sort of malfunction of the immune system. If I'm in front of a lot of doctors and I want to sound very, very educated and somebody tell me what is an allergy, I would say an allergy is a normal immune response, but it's triggered by an inappropriate stimulus. That is right, but you guys have any idea what I just said? No? Somewhere break it down. Okay? That's why you're here, right? So everybody knows about measles and chicken pox, right? Okay. So even if you're not vaccinated, right? Most people, they get chicken pox and the infection. But they might have little pox, little things on their skin. But what happens after a week or two? They get better, right? The reason they get better is that the immune system kicks in. So the immune system identifies that, there is this little virus here that wants to destroy this body. We're not going to allow that to happen. So it mounts an immune response, and it does its thing, and the chicken pox goes away. A peanut is not supposed to be dangerous. So in Jakeem's case, when he eats peanuts, his body perceives that the peanut is dangerous. It's really not dangerous, but for reasons we don't know, the body perceives that it's dangerous and does what the immune system does. It tries to destroy it. So, Jakeem's face might become swollen. He may vomit. You have hives. So the immune system is doing what it's supposed to do. Yeah? The only thing, though, it's doing it's been triggered by something that should not trigger it. So when you have the immune system doing what it's supposed to do, for something it really isn't designed to do, that's what an allergy is. So if I go back and say an allergy is a normal immune response triggered by inappropriate stimulus, now you understand what I just said, right? True or false? We're dealing with peanuts tonight, right? So we'll just deal with peanuts. So before you guys leave here tonight, you're going to know the difference between sensitivity and an allergy, okay? Right? That's the biggest thing I want you guys to understand. So in Jakeem's case, they figure he may have had peanut allergy. So how would the doctors have done that? There's basically two ways. They could have drawn his blood and looked for a specific antibody, is an allergy antibody that is specific for peanut. So in Jakeem's case, the doctor would either have drawn a blood test looking for peanut-specific antibody, or if he had come to me, I would do what's called a skin test looking for that antibody. So if it comes back positive, usually all we can say is that he makes this antibody, so he's sensitive, okay? And so when we test for antibodies for whichever substance, if it's positive, we say the person is sensitive. Now, who else in here, anybody here has peanut allergy? No, I would be very surprised if all of you guys came to my office and I tested all of you. I am almost positive one or two of you will test positive for peanuts, okay? Even though you be eating peanuts and have no problems, okay? So in that instance where, we test you and you have the positive antibody, then you're sensitive. Now, what makes you allergic is, in addition to eating, to having that positive antibody, if you have a problem when you eat the substance, or get exposed and you have a reaction, that is an allergy. So there are a lot of people who, if we just test them, they will have a positive result. It does not mean that they're allergic. So sometimes in situations like that, parents will come and say, well, I have somebody who is allergic, and I want everybody to be tested, okay? And sometimes we'll ask them, well, do they have any problems eating that stuff? No, I still want to test them. So that's usually not good, because sometimes there's a lot of confusion, because in people's mind, if the test results come back positive, a lot of people think the person may be allergic when in fact they're not. So that's an important thing. So sensitivity just means that you have the positive result. Allergies when you have the positive result and you have a bad problem when you get exposed to whatever you had. Got that? So everybody, when we quiz you at the end of the talk, everybody will pass, right? Okay. Now, this is another way of looking at allergy and sensitivity. This is my good friend here. It's called a mast cell. Yeah? This is what makes an allergy, because we know everything about mast cells. Now, you've seen people with allergic reactions, right? And they swell up, right, or they have all the problems. The reason all the symptoms and signs they have is because of this mast cell. So when they have allergic reaction, you see all these little granules. They release all the chemicals, and it will cause them to itch, swell, cough. So that's what happens. Now, for people who don't have any allergies, they don't have any, you can picture my friend the mast cell without any of these little things here. These things are the special antibodies. So if you don't have any allergy, you don't have any of these things, okay? When we test you, if you're sensitive, you will have these little things that are there. And when you eat whatever you're sensitive to, whatever you're sensitive to is recognized by these things, and you basically have a problem, okay? So that's a true allergic reaction. The talk we're doing today is basically peanut allergies. Now, I see a lot of people here around my age, right? Most of us, when we were growing up, did we know people with food allergies? Yeah? No, that's true. But I'm not too old, but I did graduate from my allergy training back in 1990. And even then, while we were in my fellowship, we know people had food allergies, but compared to how it is now, there's a lot more people nowadays have peanut allergies. Have food allergies in general. So food allergies have been increasing in the Western world. We don't know why. There has been a significant increase since the 1990s. And if we're talking about like food allergy or peanut allergy, there's been a 2 to 3-fold increase just in the last 10 years. And in places where they didn't have food allergies, like in Asia and in Africa, we even start seeing problems with food allergies in those places too. So I know my two friends here were here last month, so they knew about anaphylaxis. And we know that foods, especially peanuts, is a major cause of anaphylaxis. Why are we concerned about peanuts? One of the problems is that if you develop a peanut allergy, then it could be it's permanent. So families who have kids with peanut allergy, they're different, because peanut allergies can cause death, okay? You remember we spoke about anaphylaxis last month, and anaphylaxis is a serious allergic reaction that may cause death. So one of the problems when people develop a peanut allergy is that it's almost for the rest of your life. Now, when I was in training, we thought that once you had a peanut allergy, 100% you'll never outgrow it. That's not quite true. 80 to 85% of kids who develop peanut allergy will have it for the rest of their life, and maybe 15 to 20% of them may outgrow it. So still 80% is quite a high number. I said it is potentially fatal, and because of this potential for a person to die, it creates a lot of anxiety and psychological problems inside the family. You guys have kids, they grow up, right? You go to restaurants, you might send them to your auntie, your uncle, your brothers, they may even sleep out. But if you have a child who is peanut allergy, you protect that child because, that child can has a potential for dying. So you're concerned when they're in school, if they're going to come in contact with somebody with peanuts, or they come in contact with peanuts. A lot of people who have kids with peanut allergies, they don't go on vacations. They don't send their kids to parties. They certainly don't sell them to sleepouts. And you have this big fear that something bad can happen, especially if you're not around. So there's some of the bad things, when you have somebody with peanut allergy. The other thing is a lot of times peanuts and other nuts are excluded from the person's diet. And if you ever look at any of the guidelines for healthy living to keep your heart healthy, nuts and peanuts figure prominently. So people who have peanut allergy, I mean, they just, they are sort of restricted in some of the things that they can have. Now, why are we here? We're here to try and figure out if, we can actually prevent peanut allergies. Now, what happens with peanuts, or allergic things? When I was in training in the not too distant past, in the 80s, and even up to 2008, 2010, the guidelines, from the American, Canadian, and the British recommendations for parents to try and prevent their kids from having allergies was that they should avoid them, Definitely avoid them for the first 2 or 3 years of your life, okay? So that's what we used to tell people up until 2008, 2010. But remember, while all this is happening, we know that there's this big, tremendous increase in food allergies in the Western world. And in addition to telling the parents not to give their kids any high allergic food in the first 2 or 3 years of life, we instructed the mothers, when they're pregnant, not to eat it. When they're breastfeeding, not to eat it. So that's what we used to tell, okay? And guess what happened? The incidence of peanut allergy and food allergy just kept on increasing. So there was an interesting article that was published back in 2008 by Dr. Lack. He's a scientist working in England. He made a very important observation. In Jewish children living in England compared to Jewish children living in Israel, the Jewish children living in England had peanut allergy 10 times greater than the children living in Israel. Same type of kids, same type of parents, same heritage, but the children that lived and grew up in Britain had peanut allergies 10 times greater than those living in Israel. Anybody here could figure out what might be happening? They looked at certain things, and the most striking thing was that in Israel, peanut-containing products were given to the babies as early as 5 or 6, 7 months, And especially there was this snack called bamba, that especially when the kids were teething, that's what the parents would give them. It was made of corn maize and peanuts. And so we said, the only difference between these two groups of kids is that in Israel, they're given peanuts quite early. And like in England, much later or not at all. So could that be the reason? Okay. So as an allergist, this is a very pivotal study. It was published in the New England Medical Journal, February 26, 2015. It's called a LEAP study, okay? And LEAP stands for Learning Early About Peanut Allergy, okay? Big sounding name. So essentially what the LEAP study did is that they tried to identify kids who are the highest risk for having peanut allergy. And who are the kids who are the highest risk for having peanut allergy? From experience, the kids who are the highest risk for developing peanut allergy have one or two pre-existing things. One, they have bad eczema, really bad eczema, and it starts quite early. Or they have egg allergy, or in some kids, they have both. So, and these things develop quite early, usually before the kids are 3 or 4 months old. So, what the LEAP study did was that they got a group of kids the enrollment started in December 2009, ended in May 2013. And what they did, they basically got 640 kids, So the kids, when they started the study, they were 4 to 11 months of age. They had severe eczema, or they had egg allergy, or they had both, okay? So you get a group of kids, and then we skin tested them, to see whether or not they were sensitive to peanut. Now, what does that mean again? So I mean, they weren't allergic. We just wanted to know whether or not they were making antibodies. So you had 640 kids between the ages of 4 and 11, and they were skin tested to see if they had a peanut allergy or peanut sensitivity. So it's either they were sensitive, i.e. they were making antibodies, or they didn't have it. They were negative. So those are two big groups. And what we did in each group was decide that we're going to, for the next, until the kids were 5, and so you had two groups, sensitive to peanuts, not sensitive. But in each group, we did two things. Each group was further divided. There was a group that would be given peanuts to eat, and there was a group that told to avoid peanuts until the kids were 5. Okay? You with me? Okay. So, as I said, there were 640 kids. Okay? Some were negative, or which was 542. Some were positive. So the positive ones didn't have peanut allergies, just that when we did the test, it came up positive. And in this group, we had basically 270 kids who ate peanuts, 270 kids who didn't eat peanuts. Okay? This group, it started out almost equal. I mean, we were trying to make it equal, but it ended up where there were 51 kids who avoided peanuts and 41 that did. Okay? And so, so you guys with me? Two groups, okay, based on their peanut sensitivity. One didn't have sensitive to peanuts, one had, but in each group, some ate peanuts, some didn't eat peanuts. And at the end of the study, what they did was that they tested everybody to see whether or not they had peanut allergy. And how that's done is that you actually would give them peanuts. Okay? So, two ways we did that. At the end of the study, we started with 640 kids, and at the end, 617 could be tested. Some dropped out for whatever reasons. The important thing, though, is that during the study, the kids who were skin test negative or didn't have any allergy to peanuts, didn't have any allergy to any other tree nuts, didn't have any food allergies, they were given what's called an open challenge. They were basically, we just gave them peanuts to eat, around 5 grams of peanuts, and they were observed for maybe 2-3 hours to see if they had any reaction. Okay? And then the other group who we knew, when the study started, they were sensitive to peanuts. We couldn't just give those peanuts to eat like that. So we did what's called a graded food challenge, where we would give them tiny amounts and gradually increase the amount to see whether or not they reacted. And what do you think the results showed? Anything? Okay. See, I'm an allergist, so I pretty excited about what these results showed. Okay. It showed that in the people, when the study started, who were skin test negative, they had no antibodies to peanuts. So they were between 4 and 11 months at age when it started, and we followed them all the way up to age 5, 60 months. And in that group who didn't eat any peanuts, 13.7 of them developed peanut allergy. Okay? Okay. But what was more important, what was more intriguing was the group that had peanuts, only 1.9% developed peanuts. Well, you guys not into statistics and stuff might say, well, even those who ate peanuts still had some allergy, but take it from me, I mean, statistics is not one of my biggest subjects, but this was a huge result. Basically what it translates to is that if you got kids who were young, who didn't have any peanut sensitivity, and you fed them peanuts, there was an 86% chance that they would not develop peanuts, and that is huge. Okay? Yeah, I mean, everything has to do with, I mean, we started with 640. At the end, we had 617. Okay, so all the calculations are done on that. So in this group, in the skin test negative group, there were 540. Nobody dropped out in that group, and I mean all were there. And if you were skin test negative and you ate peanuts pretty early, you had an 86% chance that you would not have peanut allergy. And that is huge. So what about the other group that basically when the study started, they already had evidence that they were making peanut antibody? The results are there. In the avoidance group, 35.3 developed peanuts compared to only 10.6 in the group that basically ate peanuts. And if you're not into statistics, sometimes these numbers might start to just go over you. But basically what this translates to is that if you had a young child who had eczema, bad skin eczema, they already had egg allergy, and we knew from experience that there was a high chance that a lot of these kids would develop peanut allergy. But if you were able to give those kids peanuts early, there was a 70% chance that they would not develop peanut allergy. And this was a huge, huge study. This study was done in England. I really can't see this being done in the States with all the liability and stuff, but it's a huge thing. So we now add evidence to make certain recommendations. So what I'm going to talk about is based on what I just presented. So what are the guidelines? This is what you guys are here about. So the guidelines, there are three recommendations. The first one that we have now evidence-based data is that and we'll go through that, in kids who are the highest risk for having peanut allergy, i.e. they have bad eczema, egg allergy, or both. What you should do is that so the kids, severe eczema, egg allergy, or both, high risk peanut allergy, you should either do a blood test to see if they have if they're sensitive to peanuts. You should do a skin test to see if they have a problem with peanut. And based on that, you may do what's called an oral food challenge just to see whether or not they will react. And if they don't react, you should feed them peanuts. And when should you feed them peanuts? Between the ages of 4 to 6 months, quite early, okay? So this slide is the same information, but it's more practical, okay? Now, in the Bahamas, I'm the only allergist here, okay? You have a lot more people, a lot more babies with peanut allergy, okay? So what this slide is trying to tell you is that it's the new guidelines basically take into consideration that not everybody can see an allergist. You can see if you go to your family practitioner or your regular pediatrician, and they can do a blood test to see if the baby is sensitive to peanuts. Now, we have a certain cutoff point. The units that we use in the test is called immunocap. If it's less than 0.35, then the test is negative. So if you take your child, young baby, to the doctor, your family doctor, it doesn't have to be an allergist, and they order an immunocap peanut test, and it's less than 0.35, then we're pretty confident that the chances of that person reacting to peanuts is very, very remote. And you can basically have one or two options depending on your comfort level. You can take the baby home and feed them peanuts. Or if you feel uncomfortable, the first peanut feeding can be done inside the doctor's office. Now, if your doctor draws the blood and it comes back at 0.35 or greater, then those babies basically have to be referred to a specialist. So on this side, it takes into consideration that not everybody can see an allergist, and there is a time constraint because in these babies, time is important. So the earlier you start it, the better it is. So regular doctors can order what's called a peanut-specific immunocap, and if it's less than 0.35, you can feed the baby peanuts at home or in the doctor's office. Now, this side is what I do, okay? And we have three pathways. So same thing, young kids between 0 to 6 months who have severe eczema, they have egg allergy or both. we would do what's called a skin prick test. We actually we'll put some peanut into the skin and see if they react. One of three things going to happen. Either they don't react or it's less than 0.2 millimeters, okay? And based on the LEAP study, we were pretty confident that these babies have greater than 95% chance that they won't have any reaction to peanuts. And likewise, you can feed the babies peanuts at home, or the first feeding can be inside the office. Straightforward. This is when we start having, this is when I have to start earning my money and my brain power. So if you do the skin test, and it's between 3 to 7 millimeter, we know that with increasing wheel size, there's an increased chance that those babies may react to peanuts. There's certain other things that may help us. We may do this blood test, and based on the actual level, depending on what it is, we may or may not do what's called a graded food challenge, where we start with small amounts, usually over 2 to 3 hour period, and gradually increase the amount of peanuts that the babies can have. Okay? So that is when it's 3 to 7. Okay? If it's greater than 8, if it's 8 or above, then even if they had no problem with, even if they're not classically peanut allergy, the risk of giving those babies peanuts with a wheel size 8 or above is far too high. Those babies likely do have peanut allergy, and we basically, even if they didn't have a reaction before, the safest thing is to think that they are allergic to peanuts and avoidance. Okay? So in babies with severe eczema, egg allergy, or they have both, they should be tested to see their peanut sensitivity, and based on that, they should be offered peanut-containing food. When? Between 4 to 6 months. Okay, and we feel pretty confident with that statement based on the LEAP study, because we have evidence-based data to guide us. The other two things are really straightforward. If you only have mild to moderate eczema and no egg allergy, you can safely introduce peanuts to those kids, and we recommend you do that around age 6 months. And if you have no eczema, no food allergy, you basically can introduce peanuts when you feel like. But I usually would recommend parents between 7 or 9 months. So what the new guidelines state is that, based on an earlier study which was first published in the New England Medical Journal back in 2015, in kids with the highest risk of developing peanut allergy, if you introduce peanuts to them early, there's a great chance that you will prevent them from developing peanut allergy. Okay? And what they say, an ounce of prevention is worth more than what? A pound of what? Okay. So the main emphasis on this talk is peanut allergy prevention. Now, if you have a child or you know somebody with peanut allergy and you want to treat that, that's a whole different thing. That's the next talk. But we can might be able to talk about it in the question and answer section. So, in reiteration, this is monumental, honestly, because as I said, up until 2008, 2010, the prevailing wisdom was avoid peanuts or allergy-containing foods for the first 2 or 3 years of a child's life. And by 2008, we decided that that didn't seem to be working. And after the LEAP study was published in first 2015, the guidelines are just presented. It's not just the US guidelines, it's based on that LEAP study. All the allergy societies in the entire world came together, and in 2017, they basically proposed the new guidelines to try and prevent peanut allergy, because, as I said, an ounce of prevention is worth better than a pound of cure. So as far as the peanut allergy prevention talk is, it's over. And I'm welcome to questions.
We hope you've learned a lot from this edition of the Doctors Hospital Distinguished Lecture Series. Please join us in the Loudon Conference Center on Dowsville Street every third Thursday for the monthly health talks, where you can feel free to ask your questions. Isn't your health worth it?